Well, I just want to say good afternoon, everyone. Thank you so much for joining the webinar. This is going to be a webinar on how to optimize your Social Security benefits. My name is Paul Horrocks. I'm from Financial Webinars, and I will be your moderator today. I'm about to introduce our speaker, Michael Mandarino of 123 Investing. But before I do, I want to just give you a couple of instructions. Once I turn this over, Michael's going to lead you through the presentation. If you do have any questions, please write those in the chat box, and I'll ask Michael to respond to those at the end. In addition, after the presentation, we'll give you an opportunity to schedule a one-on-one meeting with Michael to discuss your specific situation or help you optimize your Social Security benefits. I will put a link to that in the chat box in just a second, and I'll also do that closer to the end. So with that as background, what I want to do is I want to jump in. And as I mentioned, our speaker today is Michael Mandarino. He is a graduate of West Point and served overseas in both Germany and Bosnia. He left the Army in 2001 to pursue a career as a financial advisor. And he and his firm, 123 Investing, have been helping people optimize their finances for almost 20 years. So with that, let me turn things over to Michael.
Thank you, Paul. Appreciate the introduction. And welcome, everybody. Really appreciate your taking time out of your schedules today. I just want to say, with the craziness that's going on, I just want to say a quick prayer. So Father God, Lord, we just thank you, Lord, for everyone on this call. And Lord, I pray blessings over them and their families, Lord. Keep them safe from the pandemic that's going on, Lord. But Lord, today, use me as a vessel as you see fit to help them manage their potential retirement through Social Security planning. In Jesus' name we pray. Amen. So good afternoon, everyone. Again, I'm delighted that you are here today. That tells me you're interested in being proactive in planning for your retirement. Navigating the pieces of your retirement income planning strategy can be a daunting task. There are many pieces that should be considered as you embark upon this process, and we will touch on these pieces. For most of us, Social Security plays an integral part of income that we expect to receive in retirement. So today we will focus on this piece of retirement puzzle specifically. Some of you may be aware of legislative changes to some of the Social Security claiming strategies occurred as a result of the enactment of the Bipartisan Budget Act of 2015. Throughout this presentation, I will point out where these changes may apply to you. My hope is that you come away from this meeting with more clarity on the topic that you had before, but also with a greater appreciation of how the decisions you make can impact your Social Security retirement benefits. Please understand, I'm not going to tell you when or how to file Social Security retirement benefits. That's for you to decide. But I do want to open the door to a healthy financial discussion to help you explore your options. If along the way we decide and identify a retirement income gap between what you can expect to receive from Social Security and what you can actually need to enjoy a lifestyle retirement you can expect to have, I can help you explore other retirement income options, such as fixed index annuities as a potential product solution or other investment options. As Paul said, I am a full financial advisor. I am licensed in all 50 states on the brokerage side, and I love the opportunity to obviously be able to teach with you today, and that there's makes sense for us to have a follow-on meeting to do so as well. So please note that I can provide information, but I cannot give tax or Social Security advice. You should seek guidance from your tax advisor or Social Security Administration regarding your particular situation. I may be able to identify potential retirement income gaps and may introduce insurance products such as fixed annuities as a potential solution. This presentation was not approved by, endorsed by, or affiliated with the Social Security Administration or any government agency. For more information, contact your local Social Security Administrative office or visit www.ssa.gov regarding your particular situation. Regulation Best Interest Customer Relationship Summary, Form CRS, or ADV Part 3, Relationship Summary will be provided prior to any informal communication that arises to the level of a recommendation. Why is Social Security important to you? Well, to begin, I'd like to hear from you. So in the chat bar, can you please state why Social Security is important to you? More specifically, what prompted you to come on this meeting today? Again, look at your chat bar. You can kind of start typing in those answers. Throw some of your reasons out, please. And don't be shy. You know, some of the reasons that we do look at, and I'll give you some time to take a look at the chat. Supplementing income for retirement. We'll be applying for benefits soon. Thanks for sharing that. It's a lifetime income stream. Yep, absolutely. Perfect. All great ideas. I thought Social Security was an entitlement when you reach a certain age. Best time to request benefits. Yep, those are all things that we're going to be kind of taking a look at. So thank you for those that filled in. So looking at some other reasons as far as when it comes to Social Security, I paid a lot into it, so I want to get the most that I can. I need to understand my filing options. It's a big part of my retirement. I'm afraid it won't be there. Yes, many share the same concerns about specifically in that moment, whether it's still going to be there. I have questions about spousal or ex-spousal benefits or some other options. And I'm going to go take a look at, we got a few more that came in. Are there timing issues to communicate after turning age 65? Retirement for disability. Someone else says they got an appointment on Social Security on the 2nd to start paperwork for retirement. So yeah, those are all great things. I think after this presentation, we'll hopefully be able to answer a lot of those questions that really understand. We also had someone who said she's a widow and will be eligible for her husband's Social Security at age 60. So those are all great questions that we've seen. In addition to the ones you come up with, my goal today is not to dig so deeply into the complexity of Social Security that you leave feeling overwhelmed. Instead, my goal is to help you become aware of some of the variables that can impact your benefits. Recognizing what those are in steps 1 in taking control of your own retirement planning. So as I mentioned a moment ago, the Social Security retirement benefits are just one piece of retirement income puzzle. And because there are many pieces to that puzzle, we need to understand how these puzzle pieces work together, or in some cases can potentially work against us when making decisions. These pieces include other assets for retirement, your goals, your income needs, when you plan to stop working, your risk tolerance, and even potential changes you may face, such as health status. All of these and perhaps other considerations factor into making an informed decision on your Social Security retirement benefits claiming strategy and your retirement income decisions as a whole. And my hope is that by the end of this presentation, I will have brought this idea of holistic decision into focus. So why is it that we are inundated with information, articles, and even invitations to webinars like this on a regular basis, all surrounding the topic of Social Security? Well, because most of us will receive benefits at some point in our lives. Nearly 90% of Americans age 65 will receive benefits in 2019 alone. That equates to about 44.5 million Americans who will collect retirement benefits. Interesting to note that the average monthly benefit for retirees was $1,471 in 2020. It's interesting because the maximum monthly benefit at full retirement age in 2020 was $3,011. So why do you think the average benefit amount is much lower than the maximum full retirement benefit? It could be the average is due to low recorded earnings among those participants, or because many people elect to take benefits earlier than their full retirement age, or FRA. Regardless, I think you agree that with nearly 90% of us either receiving or expecting to receive Social Security benefits in the future, it stands to reason that we need to consider Social Security as an integral player in the retirement income puzzle. We need to carefully choose how we make our decisions to receive those benefits. So now we know as of today, the majority of us are going to receive Social Security benefits. How does that source of retirement income factor into the top sources for today's retirees? In June 2016, the U.S. News and World Report reported that of the age 65 and older Americans collecting Social Security benefits, 52%, at least half of their income comes from Social Security. Asset income such as dividends, interest rental income, and royalties has declined since the 1980s, but the report revealed that the median income of retirees who have assets income as a resource is twice that of those who don't. Retirement benefits such as employer-sponsored 401k plans and other types of workplace retirement benefits provide income for 44% of retirees, representing 20.9% of the aggregate income of retirees age 65 or older. Rounding out the top 4 sources of income in retirement is continued work. The report cited 29% of retirees, primarily younger retirees, receive income from employment in retirement. There are other sources, of course, but various reports and studies continue to list Social Security as a leading source of retirees' income. Which leads me back to my original thought. It is vital that we treat our Social Security benefit no differently than any other asset we earmarked for retirement. The decision we make may have a long-lasting impact to our lifetime income streams, and in some cases, as we see the Social Security income that we pass to our survivors. I know that I've been focusing on Social Security retirement benefits, but the fact is that the system pays benefits to more than just retirees. As you can see, retirees and their dependents, like spouses and even young children of those retirees, comprise 73% of the total benefits that will be paid in 2020. But Social Security also pays benefits to disabled workers and their dependents, representing 15% of the total benefits to be paid in 2020, with the remaining 12% of benefits being paid to survivors of deceased workers. With so many relying on benefits, it's no wonder that there is some question about the program's ability to sustain benefit payments. So the question you may be asking, will Social Security be there when I need it? Well, let's look at by the numbers. Today, there are approximately 56 million Americans age 65 or older. In 2035, that number is projected to rise to over 78 million. And the number of workers supporting each beneficiary of the Social Security program will go from 2.8 today to 2.3 in 2035. Combine these facts with increasing longevity, it's no wonder there is a strain on the program. You've likely heard the cover stories about the sustainability of Social Security trust funds. In fact, in summary of the last several years, including 2019's annual Social Security and Medicare Board of Trustees report, the trustees concluded that lawmakers address the projected trust fund shortfalls in a timely way and give workers and beneficiaries time to adjust them. The Bipartisan Budget Act signed on November 2nd, 2015 by President Obama contained revisions and the eventual elimination of 2 popular claiming strategies. One of these strategies, called file and suspend, was phased out for individuals who are not eligible or who were eligible but did not elect to do so by April 29th, 2016. These changes were most likely in response to the concern of the long-term sustainability of the system, so many retirees that have come to expect. The new rules define certain age and time restrictions to take advantage of these claiming strategies. We will discuss those in just a moment. Will the program that Americans have relied on for retirement income since the Social Security Act was signed in 1935 simply disappear? It's very unlikely, but additional changes to the program to increase revenue are still possible moving forward. Those could include increasing full retirement age for younger generations, increasing Social Security taxes, or decreasing incentive to delay benefits beyond full retirement age. I hope you can clearly see why Social Security is such an important piece of the puzzle. We've just painted a picture of how many people rely on Social Security as a significant source of retirement income. With that in mind, my takeaways for you tonight are these. First, your decisions on how and when to claim benefits require consideration of many factors, including those pieces of the puzzle that we discussed a few moments ago. Secondly, you will soon discover that there is no one-size-fits-all approach that applies to everyone, because your situation and the situation of the person that's on a computer in another state or in another county next to you is going to be completely different. And lastly, once you have taken the information and started to form your own conclusion on how and when to consider filing for Social Security retirement benefits, I can help you determine if there may be any retirement income gaps, or we can explore insurance products such as fixed index annuities to help address your income needs in retirement. And we really believe that knowledge, hopefully the knowledge we provide you and we can provide you to help you make the best informed decisions. So in order to gain a better understanding of Social Security, let's first take a look at eligibility. You qualify for Social Security benefits by contributing Social Security taxes on your earnings, either combined with employer contributions or fully supported as a self-employed. Generally speaking, you will need at least 10 years of work or 40 credits to be eligible for Social Security benefits. In 2020, one credit is equal to $1,410 of income. You may earn a maximum of 4 credits per year. So for example, if you earn $5,640 and pay Social Security taxes on those earnings, you will earn 4 credits that year. Once you earn 40 credits, you are entitled to receive Social Security retirement benefits as early as age 62. Even if you lack the 40 credits to be entitled to a retirement benefit, you still may be entitled to benefits on someone else's record. We'll touch base on those potential opportunities later as well. If you have questions about Social Security eligibility, make sure you click on the link that's in the chat bar to set up a meeting to discuss in further details. So now that we know how to earn entitlement to Social Security retirement benefits, the next question is, how is my benefit amount determined? Your retirement benefit is based upon something referred to as your primary insurance amount, or PIA. In a nutshell, this is the dollar amount that you will receive if elected to claim benefits at your full retirement age. You might even jot this down: full retirement age, at which I am entitled to 100% of my retirement benefits. You will quickly see that a lot of decisions you ultimately make hinge on your full retirement age. In fact, I sometimes refer to as FRA, full retirement age, as your magic age. As we move on, I will point out why. Your primary insurance amount is somewhat of a complex formula that is based upon your earnings today. The crucial thing to remember is that your PIA is based upon the highest 35 years of work. It is important to understand that if you stop working before you have 35 years of earnings, your benefit is calculated with a 0 for those years. Your benefit is calculated. So for example, if you have 20 years of Social Security taxable earnings, then your PIA is based upon those 20 years of earnings plus 15 years of 0. Conversely, if you have more than 35 years, the lowest years will be removed from the formula when figuring out your PIA. As a point of reference, in 2020, the maximum Social Security benefit at FRA is $3,011 per month. I'll remind you several times throughout the presentation that your full retirement age is an important age for many reasons. First and foremost, remember that it is the age at which you are entitled to 100% of your PIA, or unreduced benefits. As you can see by the graph, FRA is determined by your year of birth. The FRA is gradually increased to age 67 for those born in 1960 or later. And if you're born on January 1st, you should refer to the previous year. We will be referencing FRA throughout the presentation, so be sure to look now to determine what your FRA is. I'll give you a few moments. Now that we have a basic understanding of how eligibility is determined and how the benefit amount is calculated, let's look at when you can begin collecting benefits. Pay special attention to this because when you file for benefits, can have a significant effect on the monthly amount you receive. You may begin receiving benefits as early as age 62, but it can be advantageous to wait to file for retirement benefits as late as age 70. If appropriate for your particular situation, of course. Your decision will impact the benefit amount that you receive. Let's say, hypothetically, your full retirement age is age 66. If you elect to do this, if you file full retirement, if you file full retirement age, remember that you will receive 100% of your primary insurance amount, your PIA. So full retirement age is the magic age, remember? So now let's look and say you decide to take the benefits before full retirement age. If you elect to do this, you will receive a permanent reduction to your monthly benefit. That reduction can be as much as 20 to 30% depending on your full retirement age that had you waited to collect benefits at full retirement age. Alternately, if you wait until your full retirement age of age 70, you will earn delayed retirement credits, DRCs for short, for each month beyond your full retirement age that you delay filing your benefits. This increase can equate to as much as 8% per 12 months you wait to file for benefits. Once you reach age 70, your delayed retirement credits stop, however, so there's no benefit to waiting beyond age 70. So in summary, if you file early before full retirement age, you will receive reduced lifetime benefits. If you delay filing,
Michael, I just wanted to cut in here. Something happened with your microphone that we can't hear you right now.
Thank you.
All right, there you are. So we can hear you now.
Okay, so I apologize for that. So let me just go back. Just to rehash on this last slide, just to make sure that, one thing I want to harp on this slide is that the longer you wait, the better off in most cases you are. However, your longevity can really play a big part in that as well. And that's something we have on our planners we can help you decide. So let's take a look at a hypothetical example to put this idea of how your decision on when the file can affect, among other factors, the amount that you receive in lifetime benefits. So our example is Eric is a 6-year-old and his FRA is 66. If Eric files at full retirement age, his benefit would be $2,000. Now, if Eric files early at age 62, his monthly benefit would be $1,500 because he will receive a 25% reduction to his PIA for filing before his full retirement age. If instead Eric defers until age 70, his monthly benefit would be increased to $2,640 due to the delayed retirement credits he earned between his FRA and age 70. For purpose of simplicity, no cost of living adjustments is assumed in this example. So you can see there's a significant difference in the amount that Eric will receive each month upon when he elects to begin receiving the benefit. If he files early at age 62, Eric will receive a $500 reduction per month. Conversely, if he delays until age 70, he will receive a $640 monthly increase to his PIA. So you can see why determining when to file for benefits is an important decision to make based upon your unique circumstances. If you have additional questions related to when to file for benefits, make sure to set up a meeting to receive your free Social Security estimator. So let me just stop for a brief moment. And again, you can answer in the chat function. How many of you have gone onto the Social Security Administration website and signed up for an online statement? You can either show you can raise your hands or you can put in the chat. Let's take a moment and look. Looks like a few say I have. Some say no. Let's give it a few more moments. Someone says I have, okay. Someone got theirs in the mail. So one thing with the mail, they are not going to be sending out as often as they want. I believe it's actually now going to be every 5 years. So you're definitely going to want to get online and do that. So not only does the Social Security statement outline which benefits you are entitled to and an estimate of how much those benefits will be if taken early at your FRA for retirement age or age 70, SSA.gov is also filled with an abundance of helpful resources. I would encourage each of you to sign up for an online account if you haven't already done so. Your online account will provide the most up-to-date benefit amount information and your earnings history, which is how your benefit amount is ultimately determined. Verifying accuracy of your earnings should be on an annual to-do list, much like your annual credit report. Excuse me. Also, if you recall, the Equifax data breach in 2017, there was over 147 Americans' data that was potentially compromised. One of the targeted areas that criminals were using that data for was to sign up for accounts on SSA.gov. So at least make sure you sign up and have your own account to avoid any potential fraud. So I want to switch gears for a moment and talk about Medicare. So some people falsely assume that you can't have Medicare without filing for Social Security or vice versa. So let's start with the very basics of Medicare. If you're eligible for Social Security benefits or you are married to someone who is eligible, you are automatically eligible for Medicare on the first day of the month you turn 65, regardless of whether you have retired. If you have already received Social Security benefits, you are automatically enrolled in Medicare. You may be eligible for Medicare sooner if you have certain disabilities or permanent kidney failure or Lou Gehrig's disease. However, it is important to understand that your eligibility for Medicare does not hinge on whether you are receiving Social Security benefits. In other words, if you have yet to file for Social Security benefits at age 65, you are still entitled to receive Medicare. However, you must enroll to receive these benefits. You should sign up at least 3 months before your 65th birthday to receive Medicare benefits in the month you turn 65. So it is important to enroll in Medicare when you turn 65 because failure to enroll during your initial enrollment period may cause you to pay permanently higher Part B premiums, which we'll discuss momentarily. There are certain circumstances in which enrollment for Part B at age 65 is not required. For example, if you're covered by a workplace health plan, it is important to check with your employer to ensure that you do not miss important Medicare enrollment deadlines and how Medicare interacts with the coverage you receive under your employer plan. There are 4 parts to Medicare. Part A, or hospital insurance, is a premium-free but does have deductibles and copays. Part A pays for some of the costs of hospitalization, limited skilled nursing home, hospice care, and home health care. Part B requires a monthly premium and helps pay physician services, outpatient care, home health care, durable medical equipment, and some preventative services. Keep in mind that Part B does cover long-term nursing home care, which comes as a surprise to some. Part B, what you may have heard referred as a Medicare Advantage plan, which is like an HMO or a PPO. People with Medicare Parts A and B can choose to receive all their health care services through a private insurance company provided by Medicare. And Part D, Medicare is voluntary prescription drug coverage. Before enrolling in Medicare, there are a few decisions to make. The first decision is how you want to receive coverage. There are 2 main ways to get Medicare coverage: original Medicare Parts A and B, and Medicare Advantage plan, which is like an HMO or PPO. The second is whether to add prescription drug coverage. Most Medicare Advantage plans cover prescription drugs, but it can be added to some plans if it isn't already included. And then the third decision is to whether you need to add supplemental coverage, like Medigap, Medicare supplemental insurance. If you join a Medicare or Advantage plan, you don't need, and therefore you can't buy a Medigap plan. If you sign up under the traditional Medicare, a Medigap policy may be purchased from a private companies to cover some of the healthcare costs not covered by original Medicare, like co-pays, co-insurance, and deductibles. Now, I do work with a few different individuals that actually do sell that type of insurance. So again, if that's a question, please let me know in our meeting, and I can definitely connect you to make sure you find the best plans that are out there. So I would encourage everyone to visit www.medicare.gov for more information on Medicare enrollment choices. Medicare and You is an incredible, useful handbook that you may find by simply going to Medicare website and searching for it in the search engine. If you have additional questions related to Medicare, let's discuss these questions in our free follow-up meeting. Now let's shift our focus back to Social Security benefits into something that many of you may need to consider if you're planning to continue working while receiving benefits. How many of you know if you continue to work and receive benefits that your benefits may be reduced? So go ahead and answer in the chat function. I'll just give you a few more moments. Yep, there's definitely a question. Some people are getting ahead of us. Yeah, there's definitely a threshold of earnings. So continuing on, this is a critical concept for you to remember. If you receive benefits before your full retirement age and continue to work or return to work, your benefits may be reduced by the earned income limits. It works like this. If you file for benefits before your full retirement age and continue working, any earned income that you receive over $18,400 in 2020, I'm sorry, $18,240 in 2020 will reduce your Social Security benefit. This changes once you reach the year that you will obtain your full retirement age. The earning income limits increase from $18,240 to $48,600 in 2020 for the months leading up to your birth month. For every $3 you earn over this limit, your monthly benefit will be reduced by $1. The good news is that once you reach your full retirement age, this earned income limit no longer applies. So even better, the benefits that you lost previously are factored back into your benefits and paid out to you in future monthly benefit payments. So keep in mind that earned income limits only applies to income earned by the recipient of the benefit. In other words, if you have retired and are collecting benefits prior to your full retirement age, but your spouse continues to work, his or her earnings will not cause your benefits to be affected by the earned income limits. So it's better to understand how your benefits might be affected by work before you take them rather than after to avoid potential issues. So if you're working while receiving benefits prior to your full retirement age, if this may apply to your situation, make sure to bring this up in our meeting. So it might help if we look at a hypothetical example. So let's look at Jane. She's 62 years old and she elects to file Social Security benefits. Her FRA is age 66. For simplicity, let's assume she retires on January 1st. Her full retirement age benefit is $18,500 annually, but is reduced to $13,875 for claiming it at age 62. Remember, she will receive a 25% reduction to her PIA for claiming 4 years early. So Jane earns $35,000 in 2020. The annual earned income limit for 2019 is $18,240. So Jane has excess earnings of $16,760. Her benefit is therefore reduced by half of the excess, or $8,380. Her annual benefit will be reduced to $5,495 due to her earnings over the earned income limit. So now, not only is she receiving a permanently reduced benefit for claiming benefits early, her annual benefits are further reduced due to excess income. So if you're really concerned about the impact of working and receiving early Social Security benefits, we can discuss your exact situation during our meeting. So make sure to click on the calendar link to set up a meeting. Okay, so far, we've talked about potential reductions to your benefits by claiming them before your full retirement age, or if you continue to work while receiving benefits before your full retirement age. Let's shift our focus to yet another potential impact of Social Security benefits. So raise of hands or in the chat function, how many of you know that your Social Security benefits may be reduced by income taxes? I'll give you a few moments to answer. Yep, a few people say they do know. Yep, everyone seems to have a yes on that answer. So if you ever look closely at your paycheck, you'll notice that the withholdings for taxes, part of which is FICA. The FICA, F-I-C-A, Federal Insurance Contributions Act payroll taxes go to help fund Social Security and Medicare expenses. You and your employer each pay these taxes. It might be surprising to know that when it's time to start collecting your Social Security benefits, it is possible you may be taxed again on the benefits you have earned. Let's take a look at how you can determine whether income taxes on your benefits is something you may need to account for. First, you need to determine something referred to as your combined income, which is the sum of your adjusted gross income plus non-taxable interest plus a half of your Social Security benefits. And again, that's going to give you your combined income. And once you've determined the results of your combined income calculation, you need to compare this amount to the thresholds of income based on your filing status. As you can see, if you are single or head of household, and if your combined income falls somewhere between $25,000 and $34,000, as much as 50% of your Social Security benefit may be subject to ordinary income tax. Combined income above $34,000 causes as much as 85% of your benefits to be subject to ordinary income tax. The same holds true for couples. The same holds true for couples who are married filing jointly, only with slightly higher income thresholds. If you're married filing jointly with combined income between $32,000 and $44,000, as much as 50% of your annual Social Security benefits received may be subject to ordinary income tax. Combined income over $44,000 may cause as much as 85% of your annual Social Security benefits to become taxable. Combined income below $25,000 for single taxpayers or $32,000 for married taxpayers would expose none of your Social Security benefits to taxation. So if the majority of your retirement income comes from Social Security benefits, your benefits are unlikely to be subject to federal tax. But if you have other sources of taxable income such as earnings, IRA distributions, or pensions, to name a few, then you may be faced with having to pay taxes on a portion of your retirement benefits. Remember I said in the beginning that your decision surrounding Social Security requires a careful consideration of all pieces of your retirement puzzle. This is yet another example of what I mean. If you fail to consider other sources of income you earmarked for retirement or you plan to continue to work, for example, you may find yourself facing an unanticipated or unplanned reduction in Social Security retirement benefits you have actually received. If this is something you're concerned about, again, Mark, let me know this during our consultation, and we'll definitely make sure we take that into consideration. So far we've focused our attention on Social Security benefits that are related to you as an individual. We've covered an initial eligibility, the impact on taking benefits before and after your FRA, full retirement age, the basics of Medicare, and how work and other sources of income can potentially reduce your benefits. But if you are married, there are additional factors to consider. So let's start with a brief discussion of the benefits that may be available to your spouses. If you recall, I mentioned earlier that even though you might not have the required 40 credits to collect your own retirement benefits, you may still be eligible to receive spousal benefits under the record of the qualifying spouse. The conditions under which you may collect the spousal benefits are you're age 62 or older at any age if caring for a qualified dependent. You have been married for at least 1 year prior to filing for spousal benefits. Your qualifying spouse is receiving his or her own benefits. There's one exception to the qualifying spouse collecting their benefit. If he or she is at full retirement age, or older, filed or suspended their benefits by April 29, 2016, the non-qualifying spouse will be able to collect a spousal benefit if all other conditions are met. This April 29th deadline was established as part of the bipartisan budget I mentioned earlier in 2015 and placed a limited window of opportunity for eligible qualifying spouse to suspend benefits and still allow the dependent spouse to collect on his or her record. For example, if a qualifying spouse is age 59, you would not be able to collect spousal benefits even if you're age 62 or older because he or she is not yet 62 and has satisfied one of the two conditions outlined here. So while your spouse is living, you're entitled to the maximum 50% of his or her primary insurance amount. Even if your qualifying spouse delays benefits and earns delayed retirement credits, you will not be entitled to receive more than 50% of his or her full retirement age benefits while your spouse is alive. However, your benefit is reduced if you elect to receive spousal benefits before full retirement age. Conversely, if you wait until your full retirement age to collect spousal benefits, you are entitled to the maximum spousal benefit or 50% of the qualifying spouse's primary insurance amount. But what if you also qualify for your own retirement benefit? The choices outlined here based upon the year of your birth were part of the changes made under the Bipartisan Budget Act. So make sure you're aware of which set of rules govern your options. If you were born before January 2nd, 1954 or later and filed for spousal benefits before full retirement age and are also entitled to your own benefit will always be paid first. And then the difference will be paid representing the spousal benefit if that benefit is much higher. You will not receive the sum of both benefit amounts, only an amount equal to the larger benefit. Now, if you're born January 1st, 1954 or earlier and filed for benefits before your full retirement age, your own benefit will be paid first, and only if your spousal benefit to which you may be entitled is greater will you receive the higher amount. However, if you reach full retirement age, you may choose to restrict your application to spousal benefits only and wait to receive your own to earn delayed retirement credits on your own benefit up to age 70. Remember, you may have earned delayed retirement credits on your own benefit, not on any applicable spousal benefit to which you may be entitled. Why would you consider doing this? Here you can actually see that for full retirement age up to age 70, you can collect 50% of your spouse's full retirement benefit amount, allowing your own retirement benefits to be earned retirement credits up to age 70. So at age 70, you would switch from the spousal benefit to your higher retirement benefit. Remember how I said that a lot of things hinge on your reaching your full retirement age? Here's another example of an opportunity that might exist for you to enhance your benefits if you waited until your magic age to claim this, the full retirement age. But remember, you must meet age requirements above for this strategy to work for you. You're probably starting to see the complexity that I stated earlier in the beginning of this presentation. Strategies like these require careful planning and a basic understanding of the rules surrounding filing your benefits. Some of you may be wondering about potential benefits under the record of a former spouse. So let's talk a little bit about that for a moment. If you are divorced, you may be entitled to benefits under your former spouse's work record if all the following conditions are met. Your marriage lasted 10 years or longer, you are currently unmarried, and you're at least 62 years old of age or older, and your former spouse has filed his or her own benefits. If your former spouse is eligible but has not yet applied for benefits, you may qualify for divorce spousal benefits if you have been divorced for at least 2 years. The key here is that the marriage must have lasted at least 10 years. Note, 9.5 years doesn't count. So the amount that you may be entitled to receive under the former spouse's record works exactly the same way as spousal benefits for currently married individuals. In other words, if you're eligible, you are entitled to receive a maximum of 50% of your former spouse's PIA if you wait until full retirement age to claim the benefit. Conversely, you will receive a reduced benefit if you claim before your full retirement age. And here, the rules mimic those for spousal benefits that we spoke of a few moments ago. And the choices available to you are based upon the year of birth to that is outlined a moment ago as well. A common question is whether your ability to collect on a former spouse or his or her ability to collect off of your record affects the benefit of either your ex-spouse or his or her current spouse if applicable. The answer is no on both accounts. You may be starting to see yet another reason for the strain on our current Social Security trust funds. So let's switch our focus from spousal benefits while both spouses are still living to survivor benefits. If you're widowed and were married for at least 9 months before your spouse's death, you may be eligible for survivor benefits. You may claim survivor benefits as early as age 60, although your benefits would be reduced, just like other benefits you've claimed if taken before your full retirement age. If disabled, you may begin to receive survivor benefits as early as age 50 if the disability started before or within 7 years of your spouse's death. You may claim survivor benefits, more appropriately called caregiver benefits, at any time if you have eligible children, but slightly different rules apply here. And again, if you think this applies to you, let's meet to discuss this unique situation. So if you're entitled to survivor benefits, an important question is, how much will you receive? The maximum you'll receive as a surviving spouse is 100% of what your deceased spouse was receiving or entitled to receive at the time of their death. This is an important point to note. Remember, while your spouse is alive, you are only entitled to receive a maximum of 50% of his or her primary insurance amount if you meet the requirements for eligibility. That amount increases to as much as 100% upon the death of your spouse if you are at the full retirement age. And here's another crucial planning consideration. If your deceased spouse earned delayed retirement credits, you are entitled to receive them as well, not so while your spouse is living. And also keep in mind that if you elect to claim a spousal benefit prior to your full retirement age, you will receive a reduced survivor benefit based upon the number of months before your full retirement age if you claim them, just like any other benefit you claim prior to full retirement age. There are, however, unique coordination opportunities with respect to survivor benefits and other benefits to which you may be entitled. So if you're eligible for both your own individual benefit and a survivor benefit, you may choose to take one type of benefit first, then switch to the other benefit that you're entitled to later. For example, your own. Even if you are under FRA, even if you're under the full retirement age. For this reason, it is important to carefully consider how and when to file these benefits so you potentially enhance them. And finally, if you remarry at age 60 or later, or age 50 if you're disabled, your remarriage does not disqualify you from receiving survivor benefits or even divorced survivor benefits. Survivor benefits seem to fit into a world of their own, so it becomes critical for you to understand the rules associated with these benefits, particularly when coordinating with them on your own retirement benefits. It is important to review your own unique set of circumstances. Make sure that you understand all benefits to which you may be entitled. I know we've covered a lot in the last few slides on various options, benefits, but you might be entitled to. So if you have any questions about spousal, ex-spousal, or survivor benefits, make sure you mention this in our meeting, and we can talk about yours in particular. So I know we've covered a lot in these last roughly 45 minutes. And as I said in the beginning, my goal was not to overwhelm you, hopefully I didn't, with the complexity surrounding survivor benefits and Social Security benefits, but to give you a better appreciation for the importance of making decisions about your benefits. I hope that you'll be able to walk away from today's with new knowledge that will help you make informed decisions with respect to your own financial future. So let me end by suggesting 4 take-home assignments. Periodically check your Social Security statement to ensure accuracy and monitor your eligibility and estimated concerns, which estimated your benefit amounts. And again, I'd recommend if you're not on and had not applied for your socialsecurity.gov login, please do so. I'll show you, it's very easy to do. Also consider how other sources of income may impact your benefit amounts. We saw 2 ways that this could happen, right? The earned income limits for benefits received before full retirement age, while you continue to work, as well as how other sources of retirement income could potentially create a tax consequence on your Social Security benefits. So it is important to consider all of these components when making your claiming decision. The third is be aware of ways to enhance benefits to which you may be entitled. We spent a good bit of our time discussing the various benefits that might find yourself eligible for, so to make sure that you're aware of those and how you may be able to enhance those benefits by according them when appropriate. And if tonight's information has hopefully unearthed some questions about your retirement income planning strategy, please schedule a meeting, an appointment with me so we can examine your particular situation, explore how insurance products or other type of savings or investment vehicles could help meet your overall retirement needs. I'd love the opportunity to be able to sit down with you as you navigate the process of putting together your retirement income, planning puzzle pieces together. So I want to thank you for attending our session today. I appreciate the time and attending this evening. Above all, I challenge you to stay informed and empowered. And remember, you don't do retirement income planning in isolation. When we meet, which we'll do through Zoom, we will address your Social Security retirement benefits as well as other retirement assets so we can really get an accurate picture of how these particular pieces all work together. So please click on the calendar link in the chat session to set up a follow-on consultation and to receive our free Social Security benefits estimator.